The incidence of infection with Clostridium difficile, which we call c.diff, has been rapidly on the rise in the last decade, both locally in the Chicagoland area and in the United States, and really worldwide. It's really reaching epidemic proportions. We have data from 2010 showing that there was over 500,000 documented c.diff infections, and unfortunately, greater than 15,000 deaths related directly or indirectly to c. difficile infection. Nowadays, pretty much anyone can get a c. diff infection. Traditionally, the people most susceptible were immunocompromised patients, patients who've been hospitalized or chronically institutionalized, or persons who have been receiving chemotherapy drugs or antibiotics. We are seeing incidents of infection in younger, healthy patients who have not received antibiotics. There is a new procedure that we've recently started here at Advocate Christ Medical Center to address these difficult cases of both refractory and recurrent c. diff infection. This procedure involves the transplantation of stool, fecal matter, from a healthy donor into the infected patient. The procedure works, as I mentioned, by instilling the donor stool into the patient. So once we have an acceptable donor and the stool has been screened, we take that material, add liquid to it, and make it so that it's an emulsion that would be amenable to giving into the patient. Now, I work with colonoscopes every day, which is an example of one here. Usually, I'm looking for problems or trying to remove something. In this case, I'm using it to deliver this donated fecal material to the patient. So we would perform a colonoscopy in the traditional manner. This is inserted into the patient carefully while they're sedated. And then once we have it in the farthest part of the colon, we can push this material through a syringe directly into the patient as we withdraw the instrument. It's an easy procedure to do. It takes no more than about 20 minutes to deliver this material, and the effects are quite rapid. For example, we recently had a patient who had had a relapsing c. diff infection for the last 2 years. This person could not get off antibiotics for more than 3 days at a time. After several treatment courses, we decided that it would be best to try this novel therapy. Fortunately, after receiving the transplant, this person began to feel well within a few days. I saw this person back in the office recently. It's been 3 months since the transplant, and they're finally completely clear of the c. diff infection and feeling well.